Are you or your child squinting your eyes? What does that mean for the health of your eyes? So when we talk about squinting, the meaning really depends on the context. So in everyday language, squinting refers to the narrowing of the eyelids and sort of looking like that. And typically it's done by patients when they can't see clearly or if they're struggling with some kind of glare or bright light. But in international ophthalmology and more so in British ophthalmology literature, sometimes having a squint can refer to a medical term known as strabismus. This is not as commonly used in the United States, but it can be used internationally. In strabismus, the eyes are misaligned. And in today's video, we are going to talk about squinting and the narrowing of the eyelids and what that really means for the health of your eye. Hi everyone, my name is Dr. Nagori. I'm a board certified ophthalmologist and you're watching the eyefacts.com channel. So why would someone narrow their eyelids like this, and is it actually a bad thing for you to do? The partial closing of the eyelids is often done very instinctively when people can't see clearly, and their instinct is correct because when you narrow your eyelids and try to sharpen your blurry vision, you are actually reducing the amount of scattered light that is entering the eye. This then decreases the size of the blur circle that projects onto the retina. So the improvement in vision from squinting is related to something called the pinhole effect. The pinhole effect refers to the improvement of your vision that is achieved by looking through a very small hole. And this increases the depth of focus and it blocks the peripheral unfocused light rays. So by allowing central, well-focused light rays into the retina, the image quality becomes sharper and clearer. But is squinting bad for your eye health if you're doing it all the time? We're gonna get into that question in just a second, but let's talk about the pinhole a little bit more. So in the office, we will use a pinhole test to actually figure out what a person's real potential is for good vision. If a pinhole test improves patients' vision by several lines, that means that a change in the eye prescription or sort of updating your glasses or contacts will likely help you to see more clearly. It gives us a good indication that when the pinhole improves your vision, your current pair of glasses or contacts is probably not working well for you. But on the other hand, if you do a pinhole test in the office and the vision does not get any better, there could be something else that we need to investigate that could be affecting the vision. This could be things like a cataract, macular degeneration, or some kind of swelling in the back of the eye. So the pinhole is actually a very, very useful test, and that is all related to how eye squinting actually improves your vision. So basically, if vision improves when you're squinting or when you're looking through a pinhole, it could indicate that the blurring is due to a refractive error that needs to be corrected. Now, beyond just being a diagnostic test, there are also pinhole spectacles that are designed to improve vision, but these are not extremely commonly used. So now that we know that squinting works to temporarily improve your vision, let's answer the question, is squinting bad, especially if you're doing it all the time? So the good news is squinting, when it's used as a way to improve vision, meaning narrowing the eyelids to create that pinhole effect, in and of itself is not harmful for the eyes. Now, doing that constantly can cause digital eye strain and headaches and other symptoms, but constantly squinting is not going to long-term damage the actual health of the eye. But it does mean that you need some sort of medical attention to figure out what is going on. Is it that you need an update in your glasses prescription? Or maybe you have really severe glare, but why do you have severe glare? Is there inflammation in the eye? Is the eye painful? So these are things that your doctor can look at and help to answer for you. So while the good news is that eyelid squinting is not bad for you, the bad news is that it's being caused by something that should be investigated by an eye care professional. Especially for someone who has trouble with bright light conditions, we know that squinting often helps to make their symptoms less severe and their discomfort from harsh light sources less severe. So we have to figure out, why do you have this sensitivity to light? So again, another sign to just go to the eye doctor if you find yourself squinting a lot. Now, in some cases, squinting could be a sign of strabismus as well, and this is a little bit more concerning. So while, again, the act of squinting itself is not damaging, the underlying eye misalignment could be harmful to visual development, especially in children. Persistent strabismus during that critical development period when the child is very young can lead to something called amblyopia or a lazy eye, and it can actually cause permanent loss of vision in the affected eye if it is left untreated. And untreated strabismus is actually a leading risk factor for amblyopia and vision loss in children. So early detection and timely intervention is important. So if you feel like your child is squinting, you need to get them in to see the eye doctor right away. If you are an adult that's squinting, you should go into the eye doctor soon as well, just to make sure that you don't have any underlying inflammation or that your prescription does not need an update. Now, if squinting does not improve your vision is blurry, then it's also important to see the eye doctor because you may have something else going on that is making your vision blurry. What other questions do you have? Drop them in the comments below and I'll try to answer them in a future video. If you found this helpful, remember to hit like and subscribe below, and I'll see you in the next one.